Continue now with our conversation regarding the country's capacity to handle the testing with Dr. Eftyhia Vardas, and she's the head of Virology at Lancet Laboratory. Now, Dr. Vardas, we were talking about the historical backlog that we've been experiencing in both the public and private sector, as you mentioned. And now, with us going closer and closer towards our peak, what is the country's capacity to be able to handle this backlog?
Well, I think the capacity has been ramped up immensely in both public and private, but that's now been overwhelmed because of the use of the testing. And a lot of the testing is being used in a fashion. We need to be testing at the moment for those that are really sick, that are in hospital and are symptomatic, as well as healthcare workers. What we've been doing is a lot of testing for workplace people in workplaces that have had very low risk exposures, and then suddenly a workplace is closed and then the whole place is being tested. Now that's a waste of a resource that we actually don't have. The other big area where we're doing a lot of testing is the misunderstanding about after you've been tested positive and you've had a 14-day isolation, people are being retested, and that's a real waste of the resources. So we need now to make sure that our resources are actually directed to the people that really need it, which are the sick, the ones in hospital, and the healthcare workers, and the ones with comorbidities as well that might have had a contact. So we do need to rationalize how we use the testing.
So as it stands now, what are the rules regarding testing? Not everybody can test, so who can actually go and have a test?
So if you are symptomatic, you have to test. That's very important because that's part of our public health strategy to contain the spread of this disease. So symptomatic people must be tested. Healthcare workers that have had an exposure must be tested. So those are the important two groups. Hospital inpatients that might have COVID disease must be tested. High-risk patients that have comorbidities, that have had a contact, must be tested. So those are all important categories. The categories that we are unable to accommodate at this point are the day 14 after isolation with a positive test in an asymptomatic individual, close contacts and low-risk contacts in workplaces where people had adequate PPE and there was no real exposure, and also just on-demand testing for asymptomatic people that have heard of another person that has had coronavirus. So really, speak to your medical practitioner if you're uncertain, if you don't fulfill the categories, but the testing is available for the important categories that need it.
And what is the current turnaround time between conducting the test and getting your results?
Well, that's the problem with the backlog. The backlog has forced us into a turnaround time of about 48 to 96 hours sometimes. And those are the problems. So for the test to be useful, it has to have a quick turnaround time. And so the indiscriminate use of testing has forced us into having to cope with backlogs that no longer make the test useful as a public health intervention. So we are still trying to get 24 hours for our healthcare workers and sick patients in hospital, and really that's been very difficult. So it's gone up to about 48 hours in most of the private labs, and most of the private labs now can't accept others than healthcare workers and sick patients at this point.
What we have seen, Doctor, are turnaround times sometimes of weeks, that there are people who are actually still waiting for their results to come out. And there has been a little bit of confusion, perhaps a bit of controversy around the quality of the collected specimen. If you could just clear this up for us. If a sample has been sitting there for way over the 48 hours or the 96 hours that you're talking about, is it still a usable specimen?
No, and I think that this has been debated at length. After the specimen has been sitting there for 4 days, it's no longer useful. It's no longer useful as a public health tool to trace contacts and to isolate, etc. And it's no longer helpful as a virological tool because you might get a negative result after 4 days. So it's not a useful tool. And that's what we're trying to avoid. We're trying to avoid taking swabs that we then can't test. And so we have to manage the backlog by decreasing the chaotic testing and making sure that we only test those that really need it.
So what are you then saying, doctor? If a person really has been waiting for much longer than these 96 hours, do they then have to go back for another test? Should they just go ahead and presume and assume that they actually have not been tested at all?
Well, that's also been something that people have been speaking about. So if you are symptomatic and you've had an exposure and you're symptomatic, then you really do want a test and you do need to go back. So if you haven't received your results after 14 days, you would need to retest. If you are asymptomatic but have had a contact, then we are recommending isolation and no retest for those individuals.
Well, thank you so much for clearing that up for us. Certainly, I think there's still a lot of questions that South Africans are asking, specifically around the testing. And during this time when we are nearing the peak of the coronavirus, and many more will perhaps need to be tested. That was Dr. Eftyhia Vardas there, the CEO of Lancet Laboratories.